Welcome back to our channel. Today, we're diving into another critical test in the field of immunohistochemistry, the DOG-1 test. This test is essential for diagnosing specific types of tumors, and we'll be covering everything you need to know. From pre-test information to the significance of the results, let's get started. Pre-test information. Before undergoing the DOG-1 test, there are a few important pieces of information you need to provide. 1. Histopathology report. Ensure you have a copy of your histopathology report ready. This report provides detailed information about the tissue samples and is crucial for accurate diagnosis. 2. Site of biopsy. Clearly specify the site from which the biopsy was taken. This helps in correlating the test results with the clinical scenario. 3. Clinical history. A comprehensive clinical history, including any symptoms and previous medical conditions, should be provided to give context to the test results. Specifications of the test. Now, let's talk about the specifications of the DOG-1 test. DOG-1, also known as discovered on GIST-1, is a highly specific and sensitive marker used predominantly for diagnosing gastrointestinal stromal tumors, or GIST. Diseases associated. Gastrointestinal stromal tumors are the primary diseases associated with the DOG-1 marker. Accurate identification of GIST is vital because these tumors require specific therapeutic strategies, including neoadjuvant therapy and surgical approaches. Additionally, DOG-1 can sometimes stain acinic cell carcinomas arising from the salivary glands. Specimen used. For the DOG-1 test, a tissue biopsy is required. The specimen used typically comes from the suspected tumor site. The accuracy of the test is highly dependent on the quality and handling of the biopsy specimen. Components included. The DOG-1 test involves several key components. These include the primary antibody specific to the DOG-1 antigen, secondary antibodies, and appropriate staining reagents to visualize the antigen-antibody reactions under a microscope. Test report time. Once the biopsy specimen is submitted, the test report is usually available within 7 days. This time frame allows for careful preparation, staining, and analysis of the tissue sample. Test information. DOG-1 is a critical marker due to its high specificity and sensitivity for GIST. Accurate diagnosis of GIST is essential, as these tumors are often histologically similar to Leiomyosarcomas. Differentiating between these can significantly impact the treatment plan. While DOG-1 is primarily associated with GIST, some reports indicate that it may also stain acinic cell carcinomas from the salivary glands.